Now I invite Dr. Kuldeep Kumar SRIVASTAVA. He will be speaking on long-term results of combined TRAP and TRAP for primary congenital glaucoma.
A very good morning to all of you. I will be talking about results of combined TRAP for primary congenital glaucoma. I have no financial interest to disclose. Primary congenital glaucoma refers to glaucoma due to maldevelopment of trabecular meshwork. They are unassociated with major ocular abnormality and incidence is 1 in 10,000 live births. They may present with the classical triad manifestation like epiphora, blepharospasm, and photophobia. However, the presence of megalocornea, cloudy cornea, or heavy stria and deep anterior chamber are sufficient to diagnose the disease. And if corneal diameter is more than 12 mm during infancy, it is highly suggestive of primary glaucoma. The treatment is always surgical. Goniotomy and trabeculotomy has the excellent result. But in developing country like ours, where children present very late with the hazy corneas, combined trabeculotomy and trabeculotomy may be the appropriate as a first-line approach. So the purpose was to assess the long-term result of combined TRAP for primary congenital glaucoma. It was a retrospective study where medical record of children who had undergone TRAP for primary congenital glaucoma between January 10 to December 18 were reviewed, and patients who had less than 5 years of follow-up were excluded from the study. This was a small surgical procedure. Radial incision on the blue-white junction and little oozing of blood are aqueous. Now you have to pass the trabeculotome around 60 degrees. If it is in correct plane, it is effortless and very smooth. And then you rotate. Now the aqueous is leaking. Similar procedure has to be performed in other side. Now anterior chamber entry was made with 2.8 keratome and with scleral punch that peripheral anatomy and 3 tenonylon suture and conjunctiva was closed with 6A2 vicryl. The following surgery, the children were followed up at 1 day, 1 week, 1 month, 3 months, and 6 monthly thereafter. Post-op evaluation included blood characteristic, corneal diameter, axial length, IOP, central corneal thickness, and cup disc ratio. And the surgery was considered to be successful if post-op IOP was 21 or less, with or without medication, no increase in corneal diameter, and no increase in cup disc ratio. So there was 54 eyes of 32 patients during the study period who underwent CCT, but after applying the criteria of 5-year follow-up, only 35 eyes were available for analysis. 15 were male, 11 had bilateral disease, and consanguinity was present in 7 cases. The mean age at the time of surgery was 6.3 months, mean follow-up was 73 months, mean pre-op IOP was 28.4, mean post-op IOP at 1 year was 11.9, and 5 year was 12.4. This is the success rate where you can see at 5 years, the complete success rate was 74.3% and qualified plus complete success rate was 82.9%. This is the survival probability curve at 5 years with complete success, it is 0.04, and with complete plus qualified success, it is 0.083. There was a complication included shallow anterior chamber, 3 eyes, hyphimosis eyes, which resolved spontaneously without additional surgical intervention. There are no other complications. This is child operated at 2 months of age. This is operated at 1 month of age. This was operated at 3 month and 5-year-old picture. This is operated at 2-month, 1-year picture, and 5-year picture. The goniotomy and trabeculectomy are the first line of treatment for primary congenital glaucoma, but CCT may be more appropriate as first line treatment in children presenting with advanced disease and hazy cornea. CCT creates a dual exit pathway of aqueous humor through both Slim's canal and through guarded fistula of trabeculectomy. Several authors reported higher success rate of CCT than goniotomy and trabeculectomy alone. In our study, 5-year follow-up of complete success was 74.3% and qualified for complete success at 5-year was 82.9%. Our results are similar to the other studies. In conclusion, combined trap is a safe and effective procedure for treatment of primary congenital glaucoma. Thank you.
So what was new in this? Because this is known actually, so what was new in this?
It's not new, it's actually because congenital glaucoma is very rare, and an average center, they get hardly any patient. Like we get a OPD of 500-600 patients, and we get 5-6 cases in a year. So that's why we wanted to, like those who are doing like LVP, lot of cases. So I was just presenting a mid-level centers also, what can be a result like that.
And did you follow up them for their refractive errors and amblyopia? And did you any patients who required PK? And because sometimes the cornea doesn't clear up even after the IOP
Yeah,
control.
one patient required, the first patient, that's what I shown
So that, okay.
Well, visual acuity details we don't have for most of these patients, and nobody had a
Most
cataract.
of the patient, it's not, some are good, but I have not mentioned in this, but some has the poor actually, unilateral cases, they have amblyopia,
Yeah.
and we have been treating that.
So these cases, no more intervention is only one single surgery, no? That's
Yeah,
5
only
years.
single surgery, and that's the other which not success, we repeated the trap. That's
And after that, after repeating the trap, did the
no,
success
some
rate
cases
decrease?
failed, and we went into the shunt.
And 5 years follow-up, I would say, was a very short period because once a glaucoma, it's a glaucoma for lifetime. It
Yeah,
doesn't
yeah.
go off. So it's
Yeah,
like,
so that's actually the survival falls at 10 years, it goes up to 60.
yeah.
so
So, and
we-
your failure rate increases with
Yeah, so we had
time.
only till this much data, so it's actually. For a mid-level hospital, it's very difficult to get the
Yeah,
large data in
So
these
many
cases.
I think.
Are lost to follow-up.
Yes.
Whether some
But
patients
you have not mentioned separately the repeat surgeries and all, na? You have taken it as a combined procedure in one go.
No, because those gone the unsuccessful. I was presenting the success rate. Those were unsuccessful.
Okay,
Those
okay.
patients went for the other surgeries.
so
So
how
Those
much
were not
percentage?
taken into account.
Yeah, those were common failure. That's
How much percentage of these patients required topical anti-glaucoma medications?
it's around 20% cases.
And they were controlled with,
Yeah, control.
qualified success is almost 100%.
No, not sir. At 5 year, it is around 83% only. Yeah, it's not 100% that. Actually, first year it's around 91%, but at 5 year it goes to around 83%.
Thank you.
Thank you.
Thank you, Dr. Kuldeep.